Well, good afternoon. I'm Rick Dancer, and we have a new client, Crisdental, here in Eugene. And we're going to show you. I was in here talking to Michael Bratland, the dentist, the other day, and he was showing me the things that they do to get people so that everything's COVID, clean and everything's sterilized, and so people can use it and come in here and feel really comfortable. And it's pretty dang amazing. So anyway, I want you to kind of see this. I'm going to walk in here. There's no patients in the clinic right now. We made sure. Hello. So can you show them your face for a second? You don't have any clients in here, right?
We have no clients in here right now, so I think we're okay to take our masks off.
So what are you guys all about?
So here at Crisdental, we do general dentistry and family care, so we see children also. We have an incredible staff to do preventative dental along with extensive, comprehensive dental, anything up to veneers or anything that you may want.
I heard you're the fun place to go.
We're very fun.
Nobody hates to go to the dentist when they're coming here.
Never.
Thank you. Okay, guys, so we're going to go back here because I got to show you this. They have some cool stuff in here, and I want you to meet some people. Oh.
Hi.
Who are you? Okay, so you're the hygienist?
I am. My name's Haley. I'm the hygienist.
So what's this machine behind you?
So this is an extra oral suction unit. It just helps suck up all the extra aerosols.
So can you show me how it works?
I can't.
Okay, hold on. Michael, come here, buddy. So you guys, this is the dentist.
Hi. Hi.
This is Michael.
Hi.
So what is this machine?
This is a new extra oral suction unit that we bought 3 of them so that if you're working on a patient and you have aerosols, the aerosols won't make it from room 1 to room 2. So it's just an extra precaution that we're doing because of the.
So show me how it works. So sit down there and pretend like this. So look at this, you guys. So this machine is for COVID. This isn't even COVID compliance. You're just doing this because this is even better than COVID compliance. So when she goes in, if anything comes out of your mouth,
Well, aerosols.
aerosol.
Not whatever I say.
So when she's working on a patient, anything that comes out that shouldn't be in here, like COVID, that sort of thing, will be sucked up by that machine. That is so cool. So you guys, again, we're at Crisdental here in Eugene, and he's got really white teeth.
He does.
Our dentist's supposed to. Is that kind of like a dentist thing?
Yeah. Not good to have dentures.
Not good to have dentures when you're the dentist. So show me, Michael, show me what else you guys do. Because you were, after every time, you guys, so there are no patients here right now, which is why you're seeing faces. But after each time, all right, can you introduce yourself?
Hi, I'm Mariah. I'm a dental assistant here.
So after every time a patient leaves, tell me what you do.
Product here, it's cavi wipes, and we wipe down the entire room to help disinfect everything after each patient. And then we use the hypochlorous acid here, which is a new element that Dr. Bratland brought in about a month ago to help sterilize the entire room after every patient leaves.
So first you wipe it down and sterilize it, and then you use this. And this kills the COVID, Michael?
Yeah, it's actually like 90 times more potent than bleach and chlorine. And it's really safe. Let me show you. This is what I do before I go away. There's always next thing like little cranny, or what's the word I'm looking at? There's always little spaces which you can't clean very well with cavicide wipes. So when we're done with the patient, all we do is kind of spray over everything. We can spray ourselves. It's just an extra step that we're doing for precaution. We'll go over the chair. So we're just trying to keep it as clean as possible.
So does that make people more comfortable? Because for a while, you noticed people were uncomfortable coming back.
It does. I mean, some people don't realize all the extra steps that we're taking for precaution. We were, before the COVID ever happened, we were anal. Like, and my staff will tell you, we go through like a box of gloves per patient. We're very careful of not cross-contaminating. But once this COVID came out, I bought the extra oral units. I bought 3 of them. Most dentists, if they got any of them, they got 1. I got this. We're the second office in the United States to have these built in. There's one office, Dr. Harper in town, that had it, and I saw it. I'm like, I got to have it. And so we got these built in. which is great. And then you want me to show you some other stuff?
Yeah. Oh, just so you know, staff, all you women, we have somebody on here saying you guys are eye candy. So not only are they the most fun place to go to the dentist, they have the cutest staff.
So you see, this is another. I mean, we have an extra oral units. So we have three. We have 3 operatories. We're just kind of a smaller office. We're not a franchise. We're just.
You're a local guy.
Yeah, we're a local guy. Yeah, we're local, and so, but we have them in each room. And then back here in sterilization room, I've had this for a long time. There's always little things you can't. It's hard to keep clean, so we use air. We clean it like normal, and then we put like somebody's glasses, patient glasses. We'll put it in here. It's UV sterilization. And then when this COVID just happened, we went out and we bought the nicest brand new sterilizer. So.
Show me. I want to see inside.
Yeah,
it.
it's funny. It's called Alexa. So we have Alexa here.
Oh, hi Alexa. You run the Alexa.
Yep.
Because you're related. Yeah.
And we have an Alexa in the room. So if we say Alexa too loud, it always says, "How can I help you?" So
Yep.
it's a little confusing.
Get that every day.
Yeah. So we
So
have
how
this
does that
brand.
work?
It's just a built. Every dental office has a sterilizer, but this is the newest, best. It has an auto drain. It just takes care of cells. It prints out reports. It's a top of the line sterilizer. We just wanted to make sure that everything was top of the line and brand new.
Wow.
Yeah.
I didn't know like how much. I guess you wouldn't know how much you'd have to go through because you are working in someone's
We
mouth.
are. There's a lot of aerosols that get in the mouth, and you got to be, like I've always been anal when it comes to like not cross contaminating, and a lot of times, and I've worked in other offices. I've owned quite a few offices. I see a lot of things where like medical offices or dentists where they cross contaminate it, and I am constantly. Our little thing here is if I get a new employee and I see that maybe they have gloves on and they touch a handle and they're about ready to touch somebody's mouth, I'm like, I just point to the gloves and it means take off your gloves. We do not cross contaminate here. We're very way before COVID, and so. I'm somebody that will eat food off the ground, but when it comes to my patient care, I just want to have, like, I never want to cross-contaminate. I never want anybody to ever get sick because we touch something on the ground.
And for people to let their dental care go now, I did some stuff with the hospital, and people are just not going to the hospital because they're afraid. And so if you let dental care not get taken care of, you are going to have a problem.
Oh yeah, we've seen people that have neglected it, and now they come in with abscesses. They're losing some teeth. We have periodontally cleaning is probably the most important thing you can do, because if you neglect your gums, all of a sudden you have a source of infection in your mouth. The bacteria and viruses can get in your bloodstream, and they get sick. So it's really important.
So why are you the most fun dental office? You said that when we came in, and I was going, okay, because most people don't think of the dentist as being very fun.
Every dentist is kind of, dentists here can kind of be boring, and it's kind of nerve-wracking for some patients. And we kind of, not everybody, but if patients let us, we laugh and we giggle, and we actually, patients become kind of like family members. I don't know. It starts with Lindsay in the front. She's super sweet. She answers the phone. She's always like giggling and nice, and we have a good time. A lot of banter back and forth between the patients and the staff.
So tell people how you got the name for Crisdental.
So Crisdental, my brother and I, Adam, we had an older brother, Chris, and he passed away when he was 20, and I was 18 at the time. He passed away, and so I named it when I started Crisdental about 15 years ago. I wanted to honor him, but I didn't want it to be like Mike Dental, so I took out his name was Christopher with a CHRIS. But I took out the H because I thought people would think it was more an acronym, but it was my way of honoring him, and so that's where we came up with the name Crisdental.
So you guys, we're going to be doing stuff with Michael and his staff monthly and showing, because don't tell them now, but they have these other programs, these modeling programs that are super cool, but you can't show it now because we'll show it later. And then Michael's also going to be featuring some stuff we'll be doing later, but we'll talk more about that to show other aspects of the community, because you are like a Sheldon guy. I mean, you're from this area.
Yeah, I went to Churchill. My kids went to Sheldon. Funny, when we're growing up, we kind of, my brother and I, we were brothers. We grew up in Eugene, Springfield, went to Junction City, Elmira, ended up at Churchill. My kids go to Churchill. My brother Adam's kids go to, my kids go to Sheldon. They go to Churchill and Willamette. So we're definitely, we pretty much lived almost all of our life in Eugene, Springfield.
So somebody came on and said, sweet story about your brother. Yeah, I mean, it is really neat. Isn't that it's important, isn't it?
Yeah, and Chris was a really nice, just a sweet, loving guy. Everybody loved Chris.
So you were going to be a newscaster, and then you decided to be tell him
I didn't know exactly. Okay, so I got my journalism degree, and at University of Oregon. I didn't know what I was going to do with it, and for a while there, I worked at Umpqua Dairy. I did their marketing. And then I just kind of wanted to change. And when I was my wife and I were talking about what different kind of careers, I kind of wanted to do something. I had a lot of respect for a couple of dentists that I'd met in my life, and I'm like, I can do that. And so I went back to school. Had to go back through school because I'd never taken science classes ever. That was hard. And I went to Tufts Dental School in Boston, and came back. Started practice in Roseburg, and this was my second office that I had a couple years later. And so,
Jason, his last name is Bratland. Bratland. People are asking.
Oh, okay, yeah. So so if you have, I mean,
but don't call him doctor. He is a doctor, but just call him Michael or Bratland or
unless
something.
I don't like you and disrespect. No. But yeah, you can call me Mike. But yeah.
So how do people get a hold of you, and what does it take to get in here and kind of get going?
Always, and that's one thing that makes us different, is if you're a patient of mine or not a patient of mine, if you're in pain, I'm going to see you. I'm going to stay late, or I'm going to show up early. If you call here and you say, I have a toothache or I need to be seen, I give my personal cell number to all my patients. So if you're a patient of mine and you walk out this door, I'll give you my cell number. And patients will call me. I have grandparents that will text me about their grandkid. It's a lot easier when you have the doctor's cell phone number to just call or take a picture of your grandkid's tooth, and I can get on the phone with them. So, but all you have to do is you call the number here. You go to Crisdental.com, or you can just call the 541-762-2747, and that's 672 Chris CRIS.
Michael, thanks.
Yeah.
All right, we will be back next month. We'll be doing more with Michael and his staff. And anyway, so that's how you get a hold of them. Crisdental.com, and that is CRIS Dental, all one word. And they're located right over at Oakway. In fact, from their door, out the window, you can see Trader Joe's. So I'm Rick Dancer. Thanks for joining us. And again, welcome Crisdental to our family of folks that we produce stuff for every month. And we will also be producing some shows from Michael about other topics of interest in the community too. All right, share this on your page, let people know, and if you're looking for a dentist, here's the place you can find. All right, see you guys later.